The days following your surgery are just as crucial as the days leading up to it. After a hip or knee replacement, you will experience a period of what I call the honeymoon stage, which occurs for just a few days post-operation. During this time, the medication and the block used during your surgery will begin to wear off, and you may feel relatively good with minimal pain. However, as the swelling increases, your pain will likely intensify. Swelling and inflammation are normal and can be managed with ice, elevation, and anti-inflammatory medications when appropriate. If you have an ice machine, use it regularly. Elevate your legs whenever possible, and remember, movement is key. While awake, move at least once per hour, even if it's just a short walk to the bathroom or dining room. Prolonged naps and sleep are fine, but when awake in bed, performing heel slides can keep your knee and muscles limber and prevent stiffness. Keep your pain medications at your bedside and be ready to take them as needed. If a home health agency was arranged for your care, they should have contacted you by now. These skilled nurses and physical therapists are an excellent resource and act as my eyes and ears, reporting any concerns or problems directly back to me. As mentioned in the MyChart video, this tool is very useful at this stage. Post-surgery questions and concerns about your incision appearance, swelling, medications, physical therapy, or follow-up appointments are common. Feel free to send MyChart messages with your questions or concerns, and you can attach a photograph of the concerning area for review. For urgent issues, calling our office during evening and weekend hours provides a quicker response. As we discussed in the pre-surgery video, maintaining proper nutrition is important. Continue a high-protein diet for several weeks after your surgery, as protein is an essential for muscle building and proper healing. We offer resources like the Accelerate XR nutritional supplement to help you achieve this. Just ask and we'll guide you in the right direction. If you're using narcotic medications for pain relief, remember they are very constipating. Be sure to use a stool softener such as Senna or Colace if you're taking these medications. Hang in there, this is a challenging time, but you will get through it. Stay positive, keep doing your exercises, elevate and move often. This phase will pass soon. Just like those before you who have climbed this mountain and succeeded, you will too.